with the information and communication and technology used by the Korean government to efficiently manage coronavirus epidemic. During the first webinar on COVID-19 for policy and technology to share experiences for the disease response, the Commissioner Clinical Services, Ministry of Health, Dr. Jackson Armoni, said the COVID-19 Epidemiological Investigation Support System helped Korea trace for positive cases easily.
Ministry of Health and the Korean government have held the first webinar and online conference on COVID-19 for policy and technology on the epidemic. For Korea, openness, transparency and information sharing is part of the principles for COVID-19 response.
We are starting from, this COVID-19 combating, with our basic principle, transparency, and then informing the public with clear information. So that's why, many countries, without any, lockdown ways. So that's why many countries are asking about us, how to combat this coronavirus situation.
The doctors on the COVID-19 team from Ministry of Health and Molago Hospital say Korea experience gives reassurance to Uganda in fighting the coronavirus.
You reduce the contact between health workers and the suspects. You reduce contact with those people at home. You are using technology, and you could get all the answers you wanted. So to me, really, you really have that advantage of technology. For us here, our infrastructure is not so comprehensive on the ground like yours. If we had that, we would be like you.
But there are concerns over which webinar was silent about how to prevent registering mortality cases in case all efforts fail. However, South Korea has one of the lowest COVID-19 case mortality rates in the world at 2.31%.
My fear is, should Uganda walk that path and we register this very vast mortality, how shall we handle? We seem only to be preparing to tackle, the diagnostic aspects, the clinical care management aspects.
Like confirmed in the later stage, people could be suffer from the severe cases. But from our case of the early detecting helped or reducing the mortality rates.
The health team on coronavirus in Uganda also learned that Korea has testing facilities which made it possible to take away positive people from the community.
With the issue for a country like Uganda, where 50% of the cases are asymptomatic, I'm wondering whether there is a role for immunoassay tests, what it can play, whether antigen assays or antibody assays.
Locally, we may have constraints regarding testing and diagnosing, but I think that is one area as a country and as an institution we may need to scale up in the control against this disease.
From what they have shown us, the specificity and the sensitivity varies. So most of the time we are still relying on the PCR test, which has a high sensitivity and high specificity. But only that we only do these tests in one place, that is the Virus Research Institute.
Meanwhile, members of the public have been cautioned against swallowing chloroquine and hydrochloroquine to treat COVID-19 without consulting a doctor. I'm Nafka Farida and Helen Barbara in Kampala.